Hi, I'm from hand hygiene. So, my name is Taryn. I'll be your student nurse for today.
Okay.
Can you tell me your name and date of birth?
It's 12/21 of 95, and my name is Sam Yeager.
Okay, so that matches her wristband. I'm gonna provide some privacy here, as much as we can in this situation. Okay, so today we're gonna be doing what's called a head to toe assessment. And if you have any questions throughout the entire process, I just want you to let me know. So first we're gonna start out with your vital signs.
Okay.
So I'm gonna start with getting your blood pressure. And what do you normally run for your blood pressure?
Like 120/74.
Okay. Get this cup on. And how are you doing today, Sam?
Just dandy.
Just dandy. That's what we like to hear. I'm gonna hook this guy up. And
I haven't had one of these checkups in a long time.
very tidy. Just relax that arm.
Oh, also do a quick around the room so she knows that there's no notes around the walls.
So yeah, you're at 120/78,
Perfect.
which is right in line with what you're saying. Okay, next we are going to be checking your temperature. Got a little thermometer right here. Just gonna ask you to open up. We're gonna put this under your tongue. Still reading. Okay, we got 97.6. Next, we're going to be checking her her pulse and her respirations. So I'm just going to check right here. Checking for 30 seconds. And what do you do for a living, Sam?
I grow bugs.
That sounds like fun.
It's not, but it pays the bills.
And do you do that part-time, full-time?
Oh, part-time. I go to school the other part-time, so.
What are you going to school for?
Someday I thought I'd be a nurse, so I'm gonna keep going for it.
Nice.
Be cool like you.
Oh, there you go. Okay, so we have respirations at 16 breaths per minute, which is within the range that we'd want, and her pulse is at 70 beats per minute, which again is what we want. So I'm going to put this on your finger. It's called a pulse oximeter. We obviously have to kind of make it up today. So we're waiting for that to beep, and it beeps. She's at 98% oxygen saturation. So all of her vital signs are within normal limits with what we'd want to be seen. So next I'm going to be doing a pain assessment for you. I'm going to be asking you a couple of questions. Are you currently having any pain right now?
A little bit.
And when did your pain begin?
It began yesterday morning.
And where is it located?
On my arm.
And is this something that's like constant, or does it kind of come and go?
It comes and goes when I'm not thinking about it. It doesn't hurt as bad, but if I'm thinking about it, it hurts.
And how would you describe your pain?
Like a burning, itching sensation, kind of.
Is there anything that makes it worse?
Yeah, the heat.
Heat makes it worse. And then is there anything that makes it better?
Cold.
Cold. So how do you use ice packs or?
Yeah, like cool washcloth.
Okay. And how would you? Does it like radiate anywhere? Or does it stay in the same
stays
location? And is this a pain that you've dealt with before in the past, or is this new to you?
Like when I was younger and I had an allergic reaction, but that's
Okay.
about it.
And on a scale of 0 to 10, what would you give your pain right now?
A 4.
Okay, that's good to know. And we'll be addressing that later, giving you something to help you with that pain. Next, we're going to be doing just a general survey of my patient. First, I'm going to ask you a couple of questions. They might seem a little weird. Can you tell me where you are right now?
I'm at my house.
And can you tell me your name and date of birth again?
Sam Yeager, 12/21 and 95.
And what is the date?
It is April 23rd, 2020 on a Thursday.
And why are you here today?
I'm here because I could not go into the doctor's office because of coronavirus, so you're doing my checkup at home. How nice of you.
So my patient is alert and oriented times 4. She's able to answer all those questions. Do you have any sensory deficits? Like, do you wear hearing aids or have
Nope.
glasses?
I have great hearing and great vision.
Awesome. When I'm talking to her, her speech is coherent and articulate. And she's able to follow directions very clearly. Everything I've been asking, she's been able to follow. She is not hooked up to any lines and does not have any drains, so I wouldn't have to do any further assessment of that. Do you feel as though your spiritual needs are being met?
Yep.
Good. Do you want to see the chaplain while you're here?
Nope, I am A-okay.
Okay. And then again, her mood and affect are congruent and appropriate to the situation. So next we are going to be doing an integumentary assessment. So, do you ever get kind of itching of your skin or skin irritation?
Just on my arm.
Just on that right arm?
Mhm.
Okay, so we'll be looking into that as well. And I'm inspecting my patient's skin. Her color is appropriate. It's matching her stated ethnicity. I don't see any erythema, cyanosis, pallor, or jaundice. There are some lesions on this hand that I'm noticing. Other than that, I don't see a rash or bruising. Do you know of anything that I missed?
No.
Just looking at you, your skin looks in
No.
relatively good condition.
The cat attacked my hand this
The
morning.
cat attacked your hand, and I'll be palpating for temperature, which feels
Ooh,
good.
your hands are
I know
cold.
my hands are cold. So now I'm going to be looking at your fingers. I'm going to be checking for clubbing and discoloration, which her fingers look good. Next, I'm going to be checking for your skin turgor. So we're just going to pull up her skin here, and she has good return, which tells me that she's very well hydrated. Now we're going to be doing what's called a Braden assessment. I'll be asking you a couple of questions, and we're going to give you a score out of 23.
Okay.
So she does not have any sensory deficits like she said earlier, and she's able to follow instructions very clearly. So I'm giving her a 4 out of 4 for sensory. For activity, are you able to get up and walk every day and exercise?
Oh yeah, I work out 3 times a week, and I get up all the time because I can't sit still.
Oh, okay. And do you have any urinary incontinence?
Nope, just drink a lot, so I pee a lot.
Do you sweat at all?
I
Like,
work
you're really
out.
sweaty? Okay, so I would give her a 4 out of 4 for moisture. Doesn't really seem like she has a problem with that. For mobility, do you have like full range of motion, or do you use and do you use assistive devices at all?
No, I'm not some old fart.
Okay. And for nutrition, are you able to provide yourself with 3 meals a day?
Yeah, sometimes more, unfortunately.
Okay, so again, we have a 4 out of 4 for that section. And then because of her answers, I know that she doesn't have a problem with friction and shear. So that would be a 3 out of 3, giving her a total score of 23 out of 23. Awesome.
Ooh,
So-
good thing it's not golf scoring.
And next we're going to be doing a respiratory assessment. Do you have a cough right now or any
No.
sputum production?
Mm-mm.
And do you feel like you're having shortness of breath?
No.
Okay, that's all what we want to hear. So I'm looking at your chest now. I see that she has no difficulty with breathing. Her rate and rhythm of breathing is non-labored, and it's, I counted respiratory rate earlier, and again, it's within normal limits. I see symmetrical chest expansion, and she's not like tripoding or using accessory muscles, so it looks like that she's having no problem breathing. Next, I'm going to be auscultating your lungs. We'll start posteriorly, and I'm going to be going side by side to make sure that I'm starting at the bottom and comparing bilaterally. So I'm going to ask you to sit forward for me. And I'm going to ask you to take a deep breath, okay?
Okay.
Big deep breath in. And out. Breathe in. And out. Again. And 2 more good breaths. so posteriorly she has clear lungs. There was no cracking or signs of atelectasis or pneumonia. And everything was symmetric. So I compared both sides and everything was sounding great. You got some good lungs. Now I'm just going to be listening anteriorly. So if you could sit up for me and take a deep breath. And again. Okay, another deep breath. And one more time. And again, anteriorly, her breath sounds are good. And we'll listen laterally here. Okay. So all around the board, she has great lung sounds. I didn't hear any crackles or anything that would be something to be concerned about. So next we're going to be doing your cardiac assessment. Are you having any chest pain?
No.
Do you ever feel like you have like your heart is skipping a beat or you get fluttering in your heart?
No, it's a strong ticker.
Strong ticker, and there's no palpitations, it seems like. Do you ever get dizzy?
No.
Okay. So now I am going to be auscultating your heart. We're going to be listening for your heart sounds.
Awesome.
With the diaphragm in the 5 different areas. So I'm just going to make my way in a Z pattern down your chest. So when I was listening to her heart, there was no adventitious heart sounds or like murmurs that were present. There was the presence of S1 and S2, and in every spot that I checked, it was a normal rate and rhythm. So there was nothing concerning with checking your heart rate and rhythm. Next, we are going to be checking for your radial pulses. So we'll start here. We're looking for symmetry and amplitude. So it's about a 2+ pulse and it's symmetrical on both sides, which is again what we want to see. And while I'm up here, I'll just check your capillary refill of your fingers, which we have great capillary refill, which means that I know that she's getting good circulation to her fingers. Next, I'll be checking your dorsal pedis pulse, and then your posterior tibialis pulse. We have a doctor in here now. And then your capillary refill of your toes. Okay, so that's all there. And now I'm going to be checking for edema in her legs. Okay, so we have no edema here. Great. So that means that I know that there's not going to be fluid overload that ended up in her legs, which is awesome. Next, we're going to be doing an abdominal assessment for you. I'm just going to ask you to recline your chair a little. Great. So first I'm going to ask you about your bowel movements. When was the last time you had a bowel movement?
This morning about 9 a.m.
Okay, and have you had any recent changes in your bowel habits?
Nope, I go 2 times a day, every day.
And can you describe your bowel patterns?
Like what they look like?
Yeah, like is it medium? Is it large?
It's almost always medium unless I drink coffee, then it's usually pretty large. And
It's formed.
yep, formed and brown and not too hard, not too
All the good
soft.
things. All the good things. Have you had any problems with incontinence of bowel movements? Like, can you make it to the bathroom in
I
time?
always make it to the throne.
Great, that's awesome. And do you have any difficulty passing gas, or are you kind of regular with that?
Nope. Just ask my husband.
Okay. And do you have any nausea or vomit? Like, had any history of vomiting?
No.
Any changes in appetite?
No.
Man, you
Unfortunately.
are healthy, huh?
Mm-hmm.
So next I'm going to be inspecting your abdomen. So I'm just going to kind of lift up your shirt and be looking at your tummy.
Nothing great to see there, but
And I see no distension of her abdomen. It's what I would expect. It's symmetrical and everywhere that I need to everywhere that I can see. Next, we're going to be auscultating for her bowel sounds. So we're going to go in all 4 quadrants and make sure that there's bowel sounds present. Okay. And just, let me know, sorry, this might be a little cold.
It is cold.
Okay, so in all 4 quadrants, there was normal active bowel sounds. I didn't hear anything that would be unusual, and every single quadrant had sounds, so that's what we want to be looking for. Next, I'm going to be doing some light palpation of your abdomen. Let me know if there's any pain or tenderness when I palpate. Okay, how did that, any pain with that?
No.
Okay, and now I'm going to do some deep palpation here.
There's my bladder.
And again, did that give you any pain or tenderness?
No.
And I wasn't feeling any abnormal lesions, and I inspected her skin with that too, and everything was looking good. I'm going to ask you to sit up for me, and I'm going to be percussing what's called your your costovertebral angle. So you just let me know if there's any tenderness with this, okay?
Okay. No.
Okay. That's what we're going to be wanting to see in that costovertebral angle. Next, we are going to be doing your urinary system assessment.
Okay.
When was your most recent void?
30 minutes ago.
And can you describe the color of it? Was it like straw? Was it dark?
Clear.
And so no cloudiness?
No, it was like clear like a water.
Mm-hmm. And then, is there any unusual odor?
No, it smelled like pee.
Good. And do you have urgency when you have to go to the bathroom? It's like, I gotta go. When?
No, only when I have to hold it, but obviously everybody has that.
And do you have any urinary incontinence ever?
Nope.
Or can you make it to the
Always
toilet?
make it to the body.
And at nighttime, do you feel like you have to get up all the time because you gotta go to the bathroom?
Slip like a log.
Okay. So if she had a Foley catheter, I'd be doing the inspection of that, but she clearly does not have a Foley catheter. But I am going to palpate, if you could lean back again for me, palpate for suprapubic tenderness. I'm just going to palpate here. Let me know if that's giving you any problems.
No.
And there's no tenderness or distension, which shows me that she's not having like urinary retention or anything like that. Next, we're going to be doing your musculoskeletal and neuro assessment. So we're going to start with doing a fun little range of motion exercises. So I'm going to ask you to stand up for me. Okay. So we're going to start by, I want you to bring your arms all the way up to the sky and back down. And now we're going to do it against some resistance. And back down. And I want you to bring your arm across your chest, and back over, and across, and back over. And now with some resistance. Okay. Now can you curl your arm up for me and back down, and we'll do it against resistance. And turn, resistance. Can you bring out your fingers, squeeze them. Now squeeze my hands. Okay, so with her range of motion in her upper extremities, she was able to do it all on her own, and she had a full active range of motion. With her grip strength, it was equal and bilateral. She had that strength in both sides equally. Now we're going to be doing her lower extremities for range of motion. Can you bring your leg out for me? And out. And again, we'll do that with some resistance. Okay. And then kick your leg forward for me. Try not to lose your balance. Good, great. And then I want you to bring your knee up to your chest against some resistance. Oh.
All over.
There we go. So again, with her legs, she has full and equal range of motion, which is what we're wanting to be seeing. I'm going to ask you to sit down for me. We're now going to be doing a cranial nerve assessment. So typically we would turn off all the lights, but we are getting a lot of outdoor light right now, so we're going to have to kind of make do. So normally we would turn the lights off and make it really dark in here. First, we're going to be checking your pupil accommodation. So I'm going to ask you to look straight ahead for me, and I'm going to shine this light in your eyes. So it's going to be 2 flashes in each eye. So just stare straight ahead. Okay, so during that, I was able to note that my patient's pupils are equal, round, and reactive to light and accommodation. Next, I'm going to ask you to follow my finger when I'm going to be putting it in the 6 cardinal signs of gaze. So just follow along when I'm moving my finger. Okay, so my patient was able to perform the 6 cardinal signs of gaze, which shows me that she has good extraocular eye muscle movement. And now I'm going to be looking at your face. I'm going to ask you to do a couple weird things. So can you blink for me? And smile big, puff out your cheeks, stick out your tongue. Let's check in to make sure she has symmetry in her face. There's no drooping. Now we're going to be doing what's called a sensation test. So I'm going to ask you to close your eyes. I'm going to put this cotton swab on different parts of your body. You tell me where I'm touching, okay?
Left lower arm. Right upper arm. Left shoulder. Right knee. Left foot. Right upper thigh.
Okay. So I can see clearly there that she has all of her sensation intact. When I was doing that, she's able to correctly identify. Next, we are going to be doing your deep tendon reflexes. So I'm just going to be hitting this against your leg and checking to make sure that that's there. Just going to hold this and just relax your leg, okay? Just going to kind of pull this up to make it. There we go. There you go. Okay. Just relax that leg. Okay, so her deep tendon reflexes were there. I can see that it was moving good. And then last, I'm going to ask you to point your toes up towards the ceiling and back down towards the ground. So that was checking her dorsiflexion and plantar flexion, which was there. And do you have any questions for me, Sam? And is there anything I can do for you right now? Okay, I'm going to talk to the doctor about your pain and your rash, and we'll get back to you, okay? It was nice taking care of you.
Thanks.